Hello, everyone, and welcome to today's session on community mobilization, co-development, and program evaluation, experiences from the Stockholm Prevents Alcohol and Drug Problems community-based interventions. I am Verna Felipe, ICUDDR's Educational Programs and Regional Support Coordinator. On behalf of ISSUP and ICUDDR, we thank you for being here. If you are a faculty from a higher learning institution, we invite you to sign up for ICUDDR membership. And for practitioners, we invite you to join ISSUP. Memberships for both organizations are free, and you can find more information, watch webinar recordings, and get access to drug demand reduction related resources on our websites www.isup.net and www.icuddr.org. Before we get started, I'd like to go over a few announcements to make the most of today's event. For questions to our presenters, kindly type them into the questions pane of the webinar interface on your screen. You may send in anytime during the point of their presentation, and our speakers will address them during the end of the session. Webinars and online events delivered and hosted by ISSUP and ICUDDR are provided for informational purposes. So this webinar is being recorded, and the recording will be made available for you to watch on demand after the event. Over the years, we have seen an expansion of community-based prevention. Today, our speakers will present community-based programs and the co-production process, innovative evaluation methods, and barriers and success factors. Specifically, they will share how Stockholm Prevents Alcohol and Drug Problems, or STAD, has successfully developed, implemented, and evaluated different community-based interventions focusing on substance use for the last 25 years. So our speakers for today are Dr. Johanna Grippenberg and Dr. Tobias Elgan. Dr. Grippenberg is a researcher and the director at STAD, a research and development unit with Stockholm Center for Psychiatry Research, Stockholm Country Council, and the Karolinska Institute at Department of Clinical Neuroscience. So Johanna is also a research group leader in the field of prevention science, wherein her focus is on the development, implementation, and evaluation of substance use prevention programs in the local community. Multi-component interventions, community mobilization, and co-production of prevention programs are some of her special interests. On the other hand, Dr. Elgan is a researcher at STAD. His research covers areas from multi-component community-based prevention interventions to digital interventions targeting at-risk groups. Tobias has led several randomized controlled trials as well as quasi-experimental studies. He has been involved in several international projects and is currently an expert consultant for a project on digital interventions to improve mental health among adolescents led by the National Institute of Mental Health in Czech Republic. So ladies and gentlemen, without further ado, let's hear from our speakers.
Well, thank you so much for the invitation to speak here today and for the introduction. So I'm Johanna.
And I'm Tobias.
So let's get started then. So this is the outline of our presentation today. I'm going to talk briefly about STAD, and then we're going to talk about community mobilization, co-development, program evaluation, and then give an example of one of our community-based interventions in Responsible Beverage Service. And then we're going to end with some lessons learned. So briefly about STAD, you heard Verna tell you that we are a research and development unit that is part of psychiatry research at the Karolinska Institute, and Tobias and I are both associate professors there. And we were founded in 1995. And what we do is we develop, implement, and evaluate promising methods with a focus on substance use prevention. We are researchers and practitioners working in close collaboration. And one thing that we really want to do is to bridge the gap between science and practice. We are specialists in prevention science, and we conduct work on the regional, national, and also international level. Here are some examples of different settings where we implement our interventions. So we look at different arenas in society where substance use problems are prevalent and where we could actually implement an intervention and where we could do a difference. And we're going to talk mainly about the nightlife setting today, but we also conduct interventions and research in other settings, such as sporting events, digital settings, different clinical settings, such as youth health clinics, and also in settings such as open drug scenes and different police-related settings. And as many of you already know, that when you are developing and implementing prevention interventions, you need to do it in a systematic way. And we often use GRACT model. There are many different models, and they look about the same as this one. So, you start with the mapping and the needs assessment, and then go over to the mobilization process, where you identify all the different stakeholders, finding ways to collaborate, and you formulate goals together, and you develop the intervention in co-production. And then next step is the implementation process, and then you do, of course, research and evaluation. And if your intervention is shown to have effects, then it might be you come to the next stage to disseminate the intervention. And then also management and quality assurance of the interventions once it's disseminated. So since we are going to focus a little bit and give examples on our work in the nightlife setting, we just want to give you a little background about the alcohol law in Sweden, since we are participants from all over the world at this webinar. So the legal drinking age in Sweden is 18 at the licensed premise, and the licensed premise is a bar, a pub, a restaurant, or a nightclub. And you are not allowed to serve someone who is obviously intoxicated. And obviously intoxicated is the legal term, and it means when you're drunk, obviously drunk. So drunk people are not allowed to be let in to a licensed premise also. And we want to show you a short film that our neighbors in Norway have produced. And this film is showing why it is important for serving staff not to overserve people. And it wants to show that the person that knows the least how much it's been drinking is usually the person that is drinking and getting to the intoxicated level. So please show the film. Yeah, so we couldn't show the film in the PowerPoint, so the film is sent separately now.
Here it is.
Er du åpenbart påvirket, skal bartenderen nekte deg alkoholservering. Se hva det betyr å være åpenbart påvirket på helsenorge.no alkohol.
Said in Norwegian, the last person that knows how much you've been drinking is often yourself. And it's important that serving staff is not over-serving. So now over to the presentation. So this film we're also showing when we train staff. Oh, so our interventions are often based on a system approach to alcohol prevention. So this is just a figure that is showing how we set up the intervention and what the different things we want to target. So to your right, you see violence and injuries. So what we really want to do in our work with alcohol prevention is to reduce violence and injuries caused by alcohol. And according to system theory, there are different subsystems in the community that affect the outcome. And here you can see the different boxes that are going to affect the violence and injuries. And you can see alcohol consumption at licensed premises, of course, how much people are being served and drink. And that is in turn affected by the legal sanctions, retail sales, formal regulations and control, and social norms. So according to system theory, in order to get the maximum effect of an intervention, you need to try to target as many of the subsystems in the community as possible. So this is just a way to show you how we design and think when we develop our interventions. And throughout the years, we have developed a number of different community-based interventions, but today we're going to focus on the one in the middle of this slide, Responsible Beverage Service. So now over to the community mobilization. So why is community mobilization important? Well, you want stakeholder participation. You want stakeholder ownership, because in order to co-create and produce interventions together with the stakeholders, you need to mobilize them and get them interested, right? And it's also important to build trust. And all of this is going to facilitate the implementation process. And we have found throughout the years that we've been working with community-based interventions that community mobilization is really the foundation for our work. If we do not succeed with mobilizing the community and identifying the different stakeholders and getting a good co-creation process going, we are not going to be successful in the end. And how do we work when we want to mobilize the community? We start with doing prevalence studies to look at the extent of the problem, doing different types of prevalence studies, and also needs assessment. And here we often do interviews and different surveys with the different stakeholders to find out what they think is needed to reduce problems. And then, of course, you need to identify the different stakeholders. Who are the stakeholders that need to be involved in the project that you are wanting to develop and implement? And we also make really strategic plans for the mobilization process. And one of those strategic plans is stating what's in it for me, meaning when we have identified the different stakeholders, we also map out what's in it for the different stakeholders. Why should they get involved? Why should they care about, for example, in this case, alcohol problems in the nightlife setting? So we really take lots of time to map that out, because that's going to be the argument for them to be involved. And we also create structures for collaborations. In the beginning, we created an action group with the different stakeholders, and then also smaller working groups. So in Responsible Beverage Service, for example, The action group has now turned into a steering group, and it's very formalized, and we meet 6 times a year. And then another way to mobilize the community is by media advocacy, and that is strategically working with media activities to mobilize the community and to increase the awareness of a problem, and also to increase support for the intervention that you want to implement. And talking about media advocacy, this is we want to show you another film, and this is a film that wants to describe a PR campaign that we have co-created together with the nightlife industry and authorities when it comes to raising the issue about club drug related problems and drug use. And instead of focusing on the effects that drug use has on the individual when it comes to physical and psychological related problems, in this campaign we wanted to focus on what other problems in society drug use causes, such as the environmental problems, child labor, terrorism, gang violence, and so on. So we're going to show you this film that is just describing this campaign, and it's subtitled in English.
This is your brain on drugs.
Illegal drugs are bad news.
If you've got to die for something, this sure as hell ain't it.
Det är så sällan.
Man dör inte.
Lite gräs kommer inte att skada.
Jag tar ju bara lite då och då.
Det har skett ännu en skjutning.
Cocaine production is destroying the
Deadly cartel violence has escalated across Mexico.
Using small children to work in the coca field.
Ska du med ut och döda lite mexikaner? Jag vet inte fan om det är en bra idé alltså.
Nätverket krogar i knark.
Man ska börja tänka på vilka konsekvenser det här får för samhället och världen. Så som skövling av regnskog och att pengar går till terrorism och barnarbete och gängskjutningar och kriminalitet och så.
So that was a PR campaign to increase the awareness of different societal problems that are caused by drug use in society. And that's a way that we are mobilizing the community, an example of that. And I spoke to you before that I mentioned that we always try to state what's in it for me. And one question that we often get when we work with the nightlife industry is, how do you mobilize the nightlife industry? What's in it for them? So we have stated that and what's in it for the different stakeholders here. And the other ones here are more clear, like the county council, reducing injuries and health problems, the licensing board enforcing the law, reducing problems at licensed premises, societal problems and public nuisance and crime, the police authority Their motives are law and order, the Public Health Agency of Sweden, public health, the county administration, enforcement of legislation and regional perspectives, and the union, psychosocial working environment. And more specifically, as I said, one thing that people ask even more about is what's in it for the nightlife industry. And here we have listed many different things that are important for the nightlife industry when it comes to reducing alcohol-related problems. A more safe and secure working environment for both guests and staff. It's important to remember that the nightlife industry, it is also a working place for many people, especially many young adults. And the nightlife industry also wants good relations with authorities. Being involved in alcohol prevention work is a social commitment. And you also get support from all the stakeholders and the public. Your staff is being trained, and when you have trained staff and invest in your staff, they stay longer, which leads to less staff turnover, at least in Sweden, and we know many other countries that staff turnover is quite high in the nightlife industry. And it's also good for PR to be socially conscious and care about society as a whole. And all of this together will increase profitability. And many of the different businesses in the nightlife industry are telling us that their profitability is being increased when they are working with Responsible Beverage Service, because they also get returning customers.
Okay, so I will continue and briefly talk about co-development. And there are several names that refers to participatory co-working processes, such as co-creation, co-design, co-production, co-development. And there are some differences that have been proposed between the words, like for instance, co-creation can be referred to as a co-working process that takes the project from the initiative through development, implementation, and evaluation. While, for instance, co-production can be referred to as a bit narrower and referring to the implementation process. But for all practical reasons, purposes, they can be used and are used interchangeably to refer to a co-working process. And this graph is based on a search in PubMed using these 4 words. And the graph illustrates that this is a growing field of research. There were some papers published in the early 1990s, but then in 2016, 2017, we see a rapid increase in the number of publications using these 4 words. And the most frequently used terminology is co-design, followed by co-production, co-creation, and co-development. So why should we work with co-working processes, such as co-production and co-creation? Well, by working with co-creation strategies together with stakeholders and end users, we improve the quality of the strategies. We improve the relevance of the strategies and also the acceptability of the strategies. And one can then argue that we develop more cost-efficient strategies, since it is more probable that we develop strategies that are more aligned with the end users. And by involving the stakeholders and the end users in the process, we do not use a top-down approach, but instead a more horizontal process, which increases the likelihood that they will feel a sense of ownership of the strategies. And this in turn then facilitates the implementation process, and it also increases the likelihood that the strategies are sustained over time. And co-working processes improves the relationships and thereby trust, which helps to strengthen the bonds between the organizations that are involved and the end users. And how should we then work with co-working processes? Well, first of all, co-creation should ideally guide research processes from design, development of strategies to evaluation. And it should involve all relevant stakeholders, including the end users. You need to set up a good structure for collaboration to avoid hierarchical structures and treat all parties equal. And here we mentioned previously that we work with reference groups or action groups and working groups. And it's important that they together develop common goals so that everyone understands the purpose of the project and the purpose of what is being co-created. It's also important that we share the power and the decision-making among all involved parties to make them feel included. And here we can also work with written agreements between the parties and shared responsibility. And in our program, our RBS program, then we have listed the responsibilities of the different organizations. So for instance, we provide a coordinator, we provide lectures for the training and lecture. We evaluate the project or program. The licensing board, they monitor the licensed premises. They also lectures and trainings and encourage licensed premises to have trained staff and policies. The police, they also monitors licensed premises, lectures and trainings, and also encourage licensed premises to have policies. The county administration, they lecture trainings and they are responsible for the examination. And the union, they are supposed to encourage members to in turn encourage their workplaces to have policies. So that was a brief introduction to co-working terminology and arguments for why and how you can work with co-production. And now over to some words on program evaluation. And of course, it's important to evaluate programs so that we know that, or if the program that we developed had the intended effects. And it's also a means to follow the process of the development and implementation and examination of the program. And the results can be used to mobilize the community and mobilize decision makers. Johanna mentioned that we do like prevalence studies that can be used in this for this purpose. And Johan also mentioned that the results can be used in media to raise awareness among the public or among decision makers and stakeholders. And one thing that's important is that the results from evaluation can also be used to make adjustments during the implementation phase. And obviously it provides an evidence base for the work. There are some key considerations that you need to make during program evaluation. So, for instance, it's crucial to have a clear understanding of the mechanisms by which the program is supposed to work so that we don't do so-called black box evaluations where we assess outcomes without a clear understanding of how and why the intervention did work or did not work. In line with this, it's good to develop a model which outlines how and why the program is expected to have specific outcomes. And Johanna showed you this systems theory approach previously. It's also important to do more besides the outcome evaluations. It's also important to do process evaluation, investigating how the intervention is delivered. And it's also good to keep track on fidelity. And here you can, for instance, ask yourself, were the core components delivered as intended? Was the correct dose delivered? And did the participants engage in the program? And for instance, if you see that participants do not engage in the program, then you might have to do some adaptations during the implementation to increase the participation among the people. And it's also important to keep track of intermediary variables that can explain why the activities have a specific outcome. And of course, it's important to assess both short but also long-term outcomes to see possible delayed effects of the program, or to see if we can sustain the effects. And on the previous slide, I mentioned the importance of developing a model outlining how and why a program is expected to have a certain outcome. And this is a logic model for an alcohol prevention program for sporting events that we co-created together with the football clubs in Stockholm and the arena corporations. And this is just to illustrate the how and why for this program, and also how we measured all variables. So the red box represents the outcome that we want to, so we want to decrease the alcohol-related problems at sporting events. And then the blue boxes represents different intermediate variables that influence the outcome. So for instance, level of enforcement at sporting events, or level of drinking in and around the arena. And beside the boxes, you see this little yellow dot with a variable that we can measure. So it's important to measure all the factors that influence the outcome. So if we zoom in on the level of drinking in and around arena, an even more complex picture emerges. But this then illustrates that the level of drinking in and around the arena is influenced by other intermediate variables, such as level of enforcement of restricted admissions and level of over-serving in and around arenas. The green boxes illustrate different strategies that can be implemented to improve the intermediate variables. So for instance, training of staff at licensed premises in and around arenas influence the level of over-serving. And the yellow boxes, they represent different action steps that need to be taken in order to reach the strategy. So for instance, develop a training program for staff. So the purpose here was not to go through all the details, but to illustrate how we have disentangled the black box in our alcohol prevention program. And a few words on study design. So I mentioned that we need to collect data to follow the outcome and the intermediate variables. And this can be done within the framework of different study designs. And the choice of study design is crucial to draw the best possible conclusions about the effectiveness of the interventions. And you are probably familiar with this, but study designs can be ranked based on their strength of evidence. So for instance, randomized controlled trials, RCTs, they are considered golden standards, followed by cluster randomized controlled trials, where groups are randomized rather than individuals. Then follows quasi-experimental designs, like for instance, non-RCTs, where we have a control group which was not randomized. We have interrupted time series and pre-test, post-test designs, where you collect data before and after you implement the intervention. And this is then followed by cohort studies, where you follow a group of individuals over time, and you can compare them based on if they have been exposed for an intervention or not. And then you have cross-sectional designs, where you just collect data at a specific time point, which gives you information about associations rather than causality. And here we would like to stress that while RCTs are the golden standard, it may not always be feasible or ethical to conduct them. For instance, in terms of community-based interventions, it may not be feasible to randomize communities. And in such cases, you need to go to quasi-experimental designs or cohort studies, as they are often used to provide the best available evidence if you cannot do RCTs.
So now over to Responsible Beverage Service, and here we want to exemplify the work process from development, implementation, evaluation, and dissemination. So, together with the different stakeholders in co-creation, we have defined the common goal for Responsible Beverage Service, and that is to create a safer nightlife environment for both guests and staff by reducing intoxication level and alcohol-related problems. So, and we have done that by co-creating a multi-component intervention. And the intervention consists of mobilization, collaboration, and co-creation, training, and improved enforcement. So we can divide up the intervention in 3 different categories. So over to mobilization and collaboration. These are the different stakeholders that we have identified being important to be involved in the co-creation process for reducing alcohol-related problems in the nightlife setting. You see the county council, the municipality, that's where the licensing board is situated in Sweden, the police authority, and leading nightclub owners and the union. The other component of the intervention is training, and here we have developed different types of training. The main training is responsible beverage service training that is given to serving staff at licensed premises, and it's a 2-day training. And as a matter of fact, it is now mandatory for all serving staff or licensed premises that are open till 1 a.m. or later to actually train their staff in this 2-day training. We have also created a digital training for other staff, and for example, if for live concerts or festivals, we have developed this briefer digital training. During the last couple of years, we have put lots of effort into developing a training for how to improve enforcement of the alcohol law. And here we train police officers and alcohol inspectors. And all these educations and trainings have, of course, been developed in co-creation with the stakeholders. We also have a digital training for police officers and alcohol inspectors. And we train around 400 to 600 serving staff each year. And this is just in Stockholm, municipality of Stockholm. And then the third component in the multi-component intervention is enforcement. And here we have the police and the licensing board that are enforcing the alcohol law in Sweden. And they are shifting their enforcement from a reactive to a proactive focus, which means that inspections have more of a prevention focus, and they utilize a coaching, a guiding approach. And they can do the inspections in their police uniforms, but they can also have just plain clothes, or they can be undercover.
Okay, so I mentioned earlier that one should avoid so-called black box evaluations, and Johanna earlier showed this systems model for alcohol prevention in the nightlife. And as Johanna said, this model shows how different factors influence alcohol-related violence and injuries and how they are connected. And here it's also important to follow these different factors. So for instance, violence and injuries can be followed with the police reported data or healthcare data. Alcohol consumption at licensed premises can be followed using blood alcohol concentration levels among the guests at licensed premises. We can follow legal sanctions by looking at the numbers of warnings, revocals, and fines issued by the licensing board. And we can also look at serving practices, where we look at refusal rates of alcohol service to obviously intoxicated and refusal rates of alcohol service to underaged. We have followed the work with the Responsible Beverage Service, RBS, in Stockholm during many years. And we have conducted several different studies. So for instance, we have looked at the public opinion on alcohol service at licensed premises. We have looked at alcohol service to obviously intoxicated, serving to underaged, police reported violence, cost effectiveness, institutionalization, and we have also looked at the nationwide dissemination and implementation of the RBS. And I will go through all these different studies very briefly and present some results. So if we first look at the public opinion study that we did, this was a population survey in 1999 and 2000 among 1,000 randomly selected inhabitants in Stockholm. And we could see that there was a vast majority that agreed to, for instance, service should not serve to intoxicated guests or service should not serve to minors. And we also saw that they agreed with licensed premises making obviously intoxicated guests leave the premises. So we could then conclude that we had a strong support among the population for licensed premises to serve alcohol in a responsible way and also for stricter enforcement of existing laws. Now, had the results been different, we could, for instance, have had to work with media advocacy to raise awareness on intoxication and related problems among the public. But we had a strong support for working with the Responsible Beverage Service. We looked at alcohol service to obviously intoxicated, and here we used a so-called actor study where we had professional actors who were trained to enact a standardized scene of obvious alcohol intoxication while attempting to purchase a beer at the licensed premises. And as you can see in the graph, the refusal rate was 5% at the baseline in 1996. And then we started to work with training and so on. And the refusal rate then improved over time and has remained quite stable at 70 to 80% refusal rate during the last assessments. And we can then conclude that we have sustained long-term effects in Stockholm, and these can be explained by a high level of institutionalization. I will get back to that later. We looked at serving to underaged. Here we had 18-year-olds who looked younger than 18, according to an expert panel, and they tried to purchase a beer without showing age verification. And the refusal rate was 55% at the baseline in 1996, and then it steadily increased over time. And here we could also conclude that we have sustained long-term effects in Stockholm. We looked at police-reported violence in 1994 to 2000, and here we had a control area in Stockholm and an intervention area in Stockholm. And the upper data series represents the intervention area, and the lower data series represents the control area. And as you can see in the control area, there was a steady increase in police-reported violence. We also saw this increase in the intervention area, but then in 1998, we saw a decrease. And this decrease corresponded to a 29% decrease of police-reported violence. We had health economists looking at the cost effectiveness, and they concluded that the cost savings ratio is 1 to 39, meaning that for every euro that we spent on this work with Responsible Beverage Service, the society saved 39 euros due to lower cost for police work and healthcare, etc. And we also looked at the institutionalization in Stockholm, and we could conclude that we had a high level of institutionalization based on that the program had been adopted in Stockholm. It had been sustained. We saw sustained effects. We had key leader support. There's been some structural changes. Johanna mentioned that licensed premises open to 1 or later had to send their staff to training. They had a high degree of compliance. And this graph shows the number of trained staff in Stockholm on a yearly basis. And we train about 400 to 600 staff every year. The positive results in Stockholm led to a nationwide dissemination. So it was disseminated to 200 municipalities in Sweden. There are 219 total. And we did some implementation studies and saw that only 13% of the municipalities used all 3 components, where training was the most commonly used component, followed by enforcement and collaboration via a steering group. We also looked at violence and could conclude that every component added to this work, violence was reduced by 8%. So this meant that if you work with all 3 components, violence was reduced by 8 times 3, 24%. But we concluded that it is important to have national coordination for quality assurance and see to it that municipalities work with all 3 components and not just 1 or 2 components. The program was also disseminated internationally in a EU-funded project called STAD in Europe. It was disseminated to 6 other countries. And in Spain, we did a pilot study. And here we tailored the RBS program to supermarkets since we wanted to decrease the alcohol sales in supermarkets to underage. And here you can see the results. So in the comparison area, there were basically no difference in the refusal rates at the 2 assessment points, at the baseline 2018 and at the 2-year follow-up, while in the intervention area, the refusal rates increased from 23% at the baseline to 55% at the follow-up. So we could then conclude that the program can be tailored to other countries and to other settings.
So over to some lessons learned. So STAD has been conducting multi-component community-based interventions for over 25 years. And over the years, we have learned a few lessons that we would like to share and end this presentation with. So our research has found that you need to do many things at the same time. So multi-component interventions. You cannot just train for example, staff in the nightlife setting and think that you're going to get the maximum effects. You need to do many things at the same time. So multi-component interventions. We have also found that, and other researchers, of course, with us, that the project coordinator is very important. You need to have someone that coordinates all the different program components. One success factor for us has been research and practice in close collaboration. We researchers and practitioners, we need each other, and to be able to create the best interventions, we need to work together. And not just together, researchers and practitioners, but also all the different stakeholders. So when we co-create the interventions, all the different stakeholders, they feel ownership, and that is going to aid in the implementation process. And having a structure for the collaboration, such as a steering group, is one success factor that we have identified. And there it's important to have the end users present. For example, in Responsible Beverage Service, it's the nightlife representatives that are actually going to change their behavior, their serving behavior. And to continue, the implementation process, that's a tricky one, and you need to put lots of effort into the implementation process and be strategic. And what is going to aid that is, of course, the co-creation process. And Tobias mentioned the institutionalization process. That process is also going to be strategically planned, and also for that to be successful, the co-creation part is very important. And having signed and written agreements, it's something that we also have identified to be a success factor for the sustainability of successful programs. And research and evaluation. So following the process and the effects of the projects is very important, because that is going to keep all the different stakeholders interested in continuing the work. When you see that the interventions and the strategies that you're working with is actually changing or making a difference, that's going to be a motivation to continue. And I also want to stress the fact that working with community-based intervention is a long-term approach. It takes time to plan, develop, and implement community-based interventions, and it takes even longer time before you can measure the effects of community-based interventions. So to conclude, you need to allocate enough time and resources for the community mobilization process. Co-creation is important for participation, for ownership, implementation, and sustainability. You should, of course, use the best available study design to conduct process and effect evaluation, but we also want to be clear that RCTs are not always possible to be utilized in community-based interventions. And multi-component community-based interventions, they can be effective, as we have shown here in the nightlife setting, and it's due to the fact that we're using many different strategies at the same time. And in the nightlife setting, we used community mobilization, training, and improved enforcement. And we would like to thank you so much for your attention. Here are our email addresses if you want to contact us. And Verna, you know if there are any questions.
Yes. So first of all, thank you, Tobias and Johanna. That was such a comprehensive and inspiring presentation. So as a reminder to the audience, if you have questions, you may enter it in our question pane. There are 3 questions here that I will read verbatim. So the first one is, isn't it true that the campaign arguments apply as much to the situation of the criminal status of the drugs? So I think they're trying to sort of making it parallel, that the arguments that we have are based on whether the drug is legal or illicit. like the cocaine and the production of cartel?
I'm not sure if I understand the question or if it's more a statement or something, but yeah, the campaign wanted to focus not on what happens to the individual, but more on a societal level. So we were talking about the rainforest being destroyed in the production of drugs, child labor, terrorism, and other issues that causes that drug production causes to society. So that was the focus. And of course, some of the maybe they also mean that gang violence and those parts were also, and that's something, that's a problem that we are facing in Sweden right now, and we've been facing for a number of years now, actually quite a lot of gang violence that is associated with illicit drug use and sales. Yeah.
And I love that. Actually, I think that this is just one, right? So that is just one of the projects, but I really love the way that you shift perspective, right? Making it like connected to the community in the audience, because you were right. So a lot of emerging adults now are very passionate about certain things, but they sort of have that disconnect that drugs are also part of like global warming problems and the likes.
Yes.
So thank you for that. And then this one, and again, I'm reading this verbatim. And so the framing of the campaign could be said to be exploitative of young people's immature social awareness. So are we thinking that emerging adults are, in terms of social awareness, not very much concerned about it? Is it something that I would say that you can see in your community?
Yeah, I mean, I think when different studies with the young adult population are showing that they might not even think about the fact what, you know, you use the drug and you don't really think about the fact that what problems it's causing for the environment, for example, like you were saying, climate change, but they are really concerned about the climate change, but they don't really see that connection. So that was something that we wanted to increase that awareness. And of course, some young people do know that, but it's also important maybe to be reminded about that, so that we all can make a difference, right? So yes, yeah.
Thank you. So there is another question, and I would like to add my question on this. So can you please give us a rough idea of the annual budget used to implement the project? And then my sort of addition to this is like, can you also describe the sort of the community? I mean, maybe the number of beneficiaries, right? Because it's easy just to say that this is the amount, but can we connect it to the number of programs and beneficiaries if that's okay? Thank you.
Do you want to answer twice, or?
I mean, we have in Stockholm, we have 3 coordinators working with this Responsible Beverage Service program. And I mean, the salary cost is about 250,000 euros, right, Johanna?
Yeah, I guess with all the overheads and all that, but yeah. So I guess it depends on how, you know, we have about 2,400 licensed premises in Stockholm. So when we say coordinators, they are also the ones that are attending the train. I mean, they're the instructors, and they coordinate the training. And so we are in charge of taking all the all the people that are wanting to go to the training. They sign up with us, and then they get a diploma, and we conduct and plan all the trainings and coordinate all of that. So yeah, so it depends. So we have 3 coordinators in Stockholm working with the alcohol prevention work and the club drug prevention work.
And so you mentioned that
projects.
Sorry. So you mentioned that there's about 2,400 licensed premises, and then plus the number of their staff, and then you also mentioned that some policemen. So it's I'm actually very much interested in the 1 is to 37 euros, like $1 that you spend save you 37, because normally, generally, right, what we see in prevention at least is that for $1 spend, at least here in the US, that we save $7. So that's very interesting to me. So I have maybe one last question because we are going over time. I like the fact that you mentioned how collaboration is important. I think one of the key question that I have is that how are you able to identify stakeholders? Because sometimes, right, it's kind of difficult in the community because there are more visible players, but they are more visible because they're more vocal or they're more into promoting their activities and themselves. So how does this work, at least in your experience?
As we've been trying to convey here is that the community mobilization process is quite time consuming. And as you say, Verna, it takes time to identify the right people. First, you identify the different organizations that needs, or authorities that should be involved, or municipalities. First, you identify those, and then you see who are the representatives from these different organizations or businesses that are should be asked to join. And I think it's during the process where you do the needs assessment, and when you're out meeting people and interviewing people, you ask them. So now we're going to work with this project. Who do you think should be involved? Who do you work with? So it's like it takes time to identify all the different stakeholders, because you also want the right roles and positions in the different authorities and organizations to be part of the action groups and working groups.
Thank you so much.
Do
you still have time for one last question? Okay, so thank you. So there is a question, and maybe it's relevant, like in general, they're looking for, like, how do we actually balance the fidelity and cultural adaptation sort of thing?
Yeah, that's a good question. I mean, yeah, that's a really good question, because if you take a program and you would like to try it in another setting, then probably you need to do some adaptations, but still you have to remain the core component. So it's a balance that you need to walk, and it's not always easy. Would you like to add something, Johanna?
No, but I think you're right there, that you need to look at the different program and then see how that's going to fit in that country or that region where you're going to implement it, of course. And so cultural adaptations are, of course, important, but it's always a question then, how much can you adapt the program and then say that it's still the same intervention, right? So that's it, and there's no clear line there, I think, and it's a challenge. But if you have an issue with it, I think you can always discuss that together with the original program developers. If you want to implement a program that has been developed in one country and you want to develop it in your own country, with discussions, see how can we adapt this to our culture, to fit our culture. So we've found that with other programs, and also with Responsible Beverage Service, we were not the first country doing that. That had been done in the United States, in Canada, in Australia before. So we looked at those programs and did an adaptation to the Swedish setting. So I think and the adaptations, they have to be done according to what type of laws that are in that country, right? And laws and regulations. And for example, it's really aiding us in the sustainability of this program, that it's actually mandatory to train your staff if you have a licensed premise open after one, for example. So, and those things you have to adjust to the different policies and laws in different countries.
Thank you once again. It's a pleasure to have you both with us, Dr. Elgan and Dr. Grippenberg. That was such an amazing conversation. For questions that were not answered, we'll just send it to our speakers so that you guys, and feel free to reach out to them. Their email addresses are written. It's listed there, and you will be sent a copy of their presentation as well as the recording. So again, I think like our key takeaways from this webinar is that we have to actually be familiar with our community, know your laws, the legal procedures, be familiar with your social norms. So it's actually helps to be to implement a project in its co-development and co-creation. So you should be so like collaborate, okay? And then again, one of the most important thing is that we have to be patient. Like when it comes to prevention program, it takes time not only for the development of an actual intervention, but also seeing the results. So patience is really one of the things that's important. But more importantly, and I think that's one of the inspiring things here, is that they were able to actually evaluation and monitoring and documenting like the changes are very important if we want to be able to sustain this. So I would like to thank ISSUP staff also for providing technical assistance for this event. This concludes our webinar. Thank you all for attending. We hope that you have learned something new and enjoyed the presentation. You will receive a follow-up email within 24 to 48 hours with a link to a view of recording of today's webinar. We appreciate your feedback, and we will hope that you take time to fill out the feedback survey. In behalf of ISSUP, ICUDDR, and our presenters, Dr. Grippenberg and Dr. Tobias Helgan, thank you for joining us today, and have a great rest of your day. Thank you once again. And we hope to see you in our next event. Thank you, ma'am.
Thank you.
Thank you.